Hey everyone, and welcome. Today, we are diving into a question that I bet a lot of you have asked at some point. When that ache or pain just refuses to go away, is an MRI the answer? Well, let's get into it.
So, picture this. You're in pain. Maybe it's your back, maybe it's your knee. It's been nagging you for weeks. And your first thought is probably, I just need an MRI. I need to see what's going on in there. But what if I told you that jumping straight to that high-tech scan isn't always the smartest or even the quickest way to get better?
To really understand why, we've got to decode the tools your doctor has. It's not about one being better than the other. It's really about using the right tool for the right job. So let's break down the two big ones, X-rays and MRIs.
Okay, first up, the classic X-ray. Think of this as the absolute workhorse for looking at hard stuff, like your skeleton. It's super fast, we're talking minutes, and it's fantastic for getting the big picture. Is there a fracture? How's the joint alignment looking? It's all about the bones.
And then we have the MRI. This is a whole different level of detail. An MRI doesn't use radiation at all. Instead, it uses these incredibly powerful magnets to give us a crystal clear picture of all the soft tissues. The stuff that X-rays just can't see. We're talking muscles, ligaments, tendons, and that all-important cartilage.
So, when you lay it all out like this, you can really see how different their jobs are, right? The X-ray is your quick go-to for bone problems. The MRI, that's the deep dive investigation when you suspect a soft tissue problem, like a torn ligament in your knee. They really aren't interchangeable. They work as a team.
Okay, so if an MRI gives you all this amazing detail, why on earth would your doctor suggest waiting? Well, this is where the whole story kind of flips on its head. And the answer is a little counterintuitive, but it's absolutely crucial for getting you the right care.
So here's the thing. It's not just one doctor's opinion. The biggest, most respected medical groups in the world, the ones who write the playbooks for doctors, they all recommend what's called a clinical first approach. And what that means is the most important work doesn't happen inside a giant machine. It happens right there in the exam room. And this quote just nails it. The incredible power of an MRI is also sometimes its biggest weakness. It sees everything. And a lot of times it picks up on completely normal age-related changes. Think of them like wrinkles, but on the inside. And these things often have absolutely nothing to do with why you're in pain. And that can just lead to more confusion and worry. Now just let this number sink in for a second. If you take a bunch of people over 40 who feel totally fine, zero back pain, and you give them an MRI, over 60% of them will show stuff like disc degeneration. So the takeaway is huge. Just because something looks off on a scan, it does not mean it's the cause of your pain. So what's the smarter path? Well, it looks a lot like this. It starts with a real conversation, where your doctor actually listens to your story and does a physical exam. Then you try the simple, proven stuff first, like physical therapy. And for so many people, that's all it takes. It's only if that doesn't work, or if some real red flags pop up, that the MRI becomes this super targeted, powerful tool to figure out what's next. All right, let's make this less theoretical and look at a perfect real-world example. We're going to talk about osteoarthritis, which is one of the most common reasons people have joint pain. And it's a fantastic showcase for this whole clinical first idea. In a nutshell, osteoarthritis is what a lot of us call wear and tear arthritis. It's basically what happens over a lifetime as that smooth protective cartilage on the ends of our bones starts to wear down a bit. And here's the kicker. Major health authorities like the National Institute for Health and Care Excellence in the UK are crystal clear on this. A typical case of osteoarthritis should be diagnosed clinically, meaning based on what your doctor learns from talking to you and examining you, not by rushing to an image. And here's why they're so confident. A doctor can be incredibly accurate just by checking a few boxes. Are you over 45? Does the pain get worse when you're active? Do you have some stiffness in the morning that eases up in less than half an hour? If the answer is yes, yes, and yes, an MRI usually isn't going to add any new info to get a good treatment plan started. So all of this brings us to the most important part of our whole chat today, really, what this means for you. Because understanding this process empowers you to be a way more active and informed partner in your own health. So next time you're in the doctor's office, instead of leading with, "Don't you think I need an MRI?" try framing the conversation with questions like these. They get right to the heart of what matters. What's the diagnosis? What's the goal? What's plan B? And then, when would a scan actually be useful? It helps you and your doctor get on the same page from the start. And that brings us right back to our big question. While the technology is absolutely amazing, what we've seen is that for so many of those common aches and pains, the most powerful tool isn't the one that hums and clicks. It's the conversation. It turns out that asking the right questions can be even more powerful than getting the most advanced pictures. Thanks so much for tuning in.